The World Health Organization (WHO) has just classified JN1 as a variant of concern, which can evade immunity better than previous versions of nCoV. JN1 is derived from BA.2.86, a substrain of Omicron. It possesses a distinct mutation in the spike protein responsible for entering and infecting cells, and mutations in other regions. According to the latest data from UKHSA, this is the fastest-growing strain, with a weekly rate of 84.2%. Variants of interest VOI contain genetic characteristics that make the virus more contagious, evade the body's immune system, are difficult to detect when tested, or make the disease more severe. Previously, XBB 1.5 and EG5 were also classified by WHO as VOIs. Meanwhile, a variant becomes of concern VOC when changes in the viral genome are clinically significant or have the following factors: increased transmissibility, virulence severity of disease increases, change in vaccine effectiveness, reduced effectiveness, change in diagnostic effectiveness. Current diagnostic methods are no longer effective. Alpha, beta, gamma, delta were once classified by WHO as VOCs. WHO said JN1 does not pose too much of a threat to the community. However, this organization warns that countries should be aware that COVID-19 combined with other pathogens in the winter can create a respiratory disease epidemic affecting the health system. As winter begins in the Northern Hemisphere, JN1 will increase the national disease burden, WHO stated. In the US, JN1 appears in about 20% of new nCoV infections, according to data from the Centers for Disease Control and Prevention (CDC). The agency believes that the level of infection of the virus will continue to increase. According to Zoe Health study, from December 6 until now, the UK has recorded 97,000 cases of COVID-19 symptoms. Professor Azim Majid, head of the Department of Preventive Medicine at Imperial College London, said JN1 appears to be the fastest-growing variant in the UK at present. Previous testing and treatments will still be effective for JN1. To date, experts have not recorded patients with more severe symptoms after being infected with the virus. According to the Science Communication Center, hospitalizations for the current wave of COVID-19 will peak this week. Professor Michael Planck of the University of Canterbury said JN1 could be the fastest-growing variant this year. JN1 accounts for 10 to 15% of cases in New Zealand, but if it grows at the same rate as other countries, it could become the dominant variant by the start of the new year. This could cause the COVID-19 wave to continue to rise longer, or is likely to cause a double peak, Mr. Planck commented on RNZ Radio. Experts believe that the new epidemic will last longer because people gather and travel during the new year. The risk of severe illness with COVID-19 is currently very low for most people. However, it can still be a serious illness for some people, and there is still a risk of prolonged COVID syndrome long, Mr. Planck said. According to Professor Majid, the symptoms of JN1 infection are similar to other strains. These symptoms may improve on their own over time or require simple treatment. However, if more serious conditions such as difficulty breathing develop, the patient needs to go to the hospital. With the new strains developed from BA.2.86, you not only get fever, runny nose, headache, loss of smell, but you can also get diarrhea and stomachache, she added. Professor Sheena Cruikshank, an immunologist at the University of Manchester, said JN1 has a mutation in the spike protein. This means the patient takes longer to recover or experiences more severe symptoms. One of JN1's mutations appears to help it attach better to cells, increasing its infectivity. Mutations also have the ability to evade immunity, reducing the effectiveness of past vaccines and natural infections. This week, India announced 21 cases of the JN1 variant. Scientists in this country are concerned about the new variant, but also advise people to comply with current epidemic prevention measures. Dr. Rajneesh Srivastava of Max Hospital in Gurugram City cited the latest reports from patients saying that initial symptoms of people infected with the new variant include fever, runny nose, sore throat, headache. Symptoms usually improve after 4 to 5 days. Some patients may also experience respiratory problems. Mr. Srivastava described in the Times of India. Dr. Jacob John, a virologist, said that all of the Omicron subvariants are much less virulent than previous variants. Talking about JN1, Mr. John said the following variants of the virus that causes COVID-19 are all more transmissible, and JN1 can spread throughout India. However, he does not think it can cause a wave of epidemics. The current epidemic has become endemic, with low and stable numbers, small fluctuations, he said. Although the number of JN1 infections is increasing rapidly, evidence of its severity compared to other virus versions is limited, WHO said. According to WHO, existing vaccines, including vaccines based on the original variant XBB, are still effective in protecting users against the risk of severe illness and death.